Hi everyone, I am Dr. Neha Gupta. I am a senior consultant, obstetrician and gynecologist. So in this video today, we are going to talk about something which is, which every woman undergoes, and that is the process of getting pregnant. We are going to talk about how to get pregnant naturally. So the first thing that I would like to talk about is the biological clock. Please respect the biological clock. The lady is born with a fixed number of eggs. When she is born, there is a fixed number of eggs that she has with her. And as the age advances, these eggs keep on getting depleted. It is not कि पुराने अंडे खत्म हो गए तो नए अंडे बन रहे हैं. ऐसा नहीं होता है. जैसे करके एक एक अंडा उस पूल में से खत्म होता जाता है, वो egg population कम होती चली जाती है. And this is an age-dependent phenomena. So this decline in the number of eggs happens more rapidly beyond the age of 35 years, although the decline starts beyond the age of 30 years. It happens rapidly beyond 35 years. And it is not just the quantity which is affected, it is also the quality which gets affected. All these processes, they are very much related to the age of the woman. I do agree that these days there's a trend, to delay the conceptions, to delay marriages, to delay childbearing. A lot of other things like travel, like career, they take precedence over all these things. And then there is also the option of egg freezing with the technology advancing and all. But if we really go with what nature has taught us, it is good to do things in time. So the most important thing that I would like to lay stress upon in this video is that please respect the biological clock. It is good to get married in time, and it is good to have children in time. It is good to have at least one child by the age of 30, and then the next child you can plan by, say, after another 2 years, 3 years, 4 years, and by the time you are 35 years, your family is complete. But this is a very personal choice that every female makes. As a gynecologist, that is an advice that I have to give to all the females. Now the next point is about the lifestyle. So the whole process of the way the eggs are produced, and then the fertilization happening, and then the implantation of the fertilized egg happening, everything is controlled by hormones. And there is an axis in our body. At the top of the axis is the brain, and then comes the ovaries, and then the uterus. So it is very obvious that everything is being controlled by the way our brain is functioning. So if we are very stressed, very stressed, then the hormones they also get haywire, and then the processes which are so natural for a human being, they become difficult to happen, and that is why infertility is almost becoming a modern day epidemic. So it is important to stay relaxed, do meditate, do yoga, eat very healthy, do not eat any junk food, do not smoke, do not indulge into binge drinking, and do 30 minutes of regular workout every day. Exercising releases a lot of positive endorphins, and that makes not only your mindset or your mental health positive, it will also help you to engage in a very relaxed sexual activity, which will obviously increase your chances of getting pregnant. Now coming to the scientific part of it, a lady has to be aware about the fertile window, because that is the period when the chances of getting pregnant will be the maximum. So the egg usually gets released 14 days before the next expected period. If you have a cycle length of, say, 28 days, you can expect ovulation to happen on day 14. If you have a cycle length of 30 days, you can expect the ovulation to happen on day 16. So it is always 14 days prior to the next expected period. If you have irregular cycles, then what to do? So you mark on a calendar the day your bleeding starts. That becomes first day, and then the day the next period starts, and you calculate the number of days in between these two cycles. So you mark your cycles for three consecutive months, and then you calculate an average of that. That gives you the average cycle length, and subtract 14 days from the cycle length to get your approximate day of ovulation. So fertile window is say 5 days on either side of this expected day of ovulation. So if your ovulation is expected to happen on day 14, I would say between the 10th to the 19th day of your period becomes your fertile window. In the fertile window, one must try for intercourse, have relations every alternate day. It is important not to have relations on every single day of the fertile window, and again it is good not to have a gap of more than every 2 days. Try every alternate day in the fertile period to maximize your chances of getting pregnant. Then it is important to have folic acid supplementation. Folic acid is a type of vitamin B that is needed for the development of the baby's brain and spine, and start taking folic acid the moment you start trying to get pregnant. Make sure that you are up to date with your immunizations. So the rubella or the MMR vaccine, the flu vaccine, the chickenpox vaccine if you have not had chickenpox in childhood, all these vaccinations should be on board when you start trying for a pregnancy. And in case you have any medical disorder, say if you have any problem of the kidney, of the heart, or of the brain, or of the connective tissues, and you are on some medications for these illnesses, then you must meet the specialist and make sure that the medicines that you are taking will not be harmful to the baby. So in case of any medical disorders, please meet the doctor before you start planning for a pregnancy. So try in the fertile period on every alternate day for at least 6 months. Start taking folic acid, keep a healthy weight, exercise regularly, meditate regularly, and most of the couples will be able to achieve, I would say 90% of the couples would be able to achieve a pregnancy by doing so for 6 consecutive months. If after doing all this you are not able to achieve a pregnancy, then it is time to meet a gynecologist. So I hope you found this information useful. Write into us if you have any queries around this topic, and we'll be happy to answer them for you. Thank you.